air out of your ear. It does cool the temperature somewhat. And so sometimes we do experience the caloric effect when you perform microsuction. Sometimes you can get dizzy for other reasons as well. You can stimulate particular nerves or within the ear. But also, if you've got a big plug of wax and you're sucking it out, it can create a suction effect, a cupping action. So the organ of balance in the ear is affected by temperature and also pressure. So you can still, it's not to say you still can't experience vertigo when you perform microsuction, because you can. So they're the main risks, but I think these risks are a lot more mitigated when you perform microsuction. I think with the microsuction, the biggest thing is that it is quite noisy. You're using a vacuum, and it can be, whenever I perform the procedure, I do emphasize that it's going to be noisy, and it's going to be noisier than the patient expects. To begin with, the patient may not really experience the noise because obviously their ears are full of wax, but you prepare them, and of course if it's noisy, too noisy, you ask them to let us know. Most people tolerate it really, really well though, so it's not an issue, but for some people it can be, especially if they suffer from hyperacusis. Hyperacusis is when some patients have a sensitivity to sound. So sounds that we may perceive as being quiet to moderately loud, someone with hyperacusis may experience that as being much louder and to the point where it's uncomfortable. So if at all possible, I always try and remove wax in those cases using dry instrumentation, so hooks and scoops, mechanical removal I call it. So we're not performing microsuction, but we're mechanically removing it using St. Bart's ear hook, for example, or an ear crate, a Jobson horn, or forceps. Sometimes people can suffer from tinnitus already, and tinnitus can be exacerbated by loud sounds. Of course, their tinnitus could just improve by the removal of the wax, so it can work both ways. As you can see, it's a similar issue to their right ear. This wax is really wet, sticky, it's matted. I'm just trying to leverage it off the floor of the ear canal. You can see there's a layer of skin there, some keratin. Now, when you've got patients with this amount of hair, it's probably a bit stereotypical, but mainly it's as we get older, and it occurs in men. So I'm at that age now where I'm starting to, my hair's beginning to thin slightly, and I'm not growing hair in certain parts of the body as well as I used to, but they then start to grow, especially in men, up your nostril and in your ears. So it's probably more gender and age specific when you've got this much hair in your ear. Occasionally it can obstruct the view. In this case it's not, although it may obscure the view slightly, so it may not provide always the best optics and visuals when you're watching it. But from a clinician's point of view, when we're performing the procedure, it's not really affecting me, but sometimes it can. And in those cases, I generally use the forceps and pluck the hairs out so I can obtain a better view. I've just had to use some olive oil medical grade spray here to change the consistency because it's becoming a bit difficult to remove any more wax. The oil's it's helped to lubricate the inside